Okay, so next we have chickenpox, which is also called as varicella. So this infection is also a viral infection caused by varicella zoster virus. So incubation period is 13 to 17 days and communication period is 1 to 2 days before the onset of rash to up to 6 days after the first crop of vesicle, like the first fluid filled those vesicles become into crust form. The fluid from those vesicles are dried and now they are turned into a crust, and those crops are there. The first crop means those vesicles that are developed at first time, right? Those first ones. And source of infection is respiratory infections of infected secretions of infected person, skin lesions if you, because there is fluid in those vesicles. If you are contacting direct to them without any gown and gloves, you might get this infection as well. So transmission is droplet because of the respiratory secretions. Airborne can be there and contaminated objects of a person using it, and then they're leaving their secretions on those objects, and other kids are using those toys and things, right? So symptoms you can remember from PVR. So pre is prodromal stage, which is like flu-like stage, fever, headache, malaise. Then next stage is vesicles. They will have appearing vesicles, fluid-filled blisters on their body. Next, itchy rash will be there, and then rash starts on the cheek, chest, back and face, and then spreads. So from thoracic area, then at the front, back, and then face, and then spreads to other body parts. And transmission you can remember from CCR, contact with the rash, coughing, and respiratory droplet. Complication is SPER. Spur, so skin infection, secondary infection can happen, pneumonia because of it is affecting respiratory, and encephalitis and Ray's syndrome can be linked to aspirin. So there is a big no for to avoid use of aspirin in children because it can cause Ray's syndrome and affect their eyes, right? Next is prevention is B2P, so varicella vaccine, 2 doses. First one at 12 to 15 months, second one is 4 to 6 years of age. Then post exposure prophylaxis, that is vaccine within 3 to 5 days, and immunoglobulins can be given to high risk individuals like immunodeficiency kids. So points to remember: avoid aspirin. Emphasis should be given to not to give children with viral infection aspirin to prevent Ray's syndrome. Pox means pack. Think about chickenpox as a pack of small itchy blister covering the body. Chicken vaccine can associate. Remember to prevent. Remember the preventive measure, that is vaccines for this chickenpox, right? And treatment will be symptomatic relief, so antihistamines to relieve the itchiness, calamine lotion, oatmeal baths, and acetaminophen for fever. Again, in viral infection we don't give aspirin. Acyclovir, the antiviral medication, can be given in severe cases, right? And within 24 hours on onset of rash should be started to have best effect. Nursing intervention: isolate the child, educate patients and caregivers on managing symptoms, encourage fluid intake and signs of complication, and importance of vaccination.